I'm Attaran, PhD student at McGill University in Montreal. I'm going to present the proposal of my PhD project in this conference. I will be trying to understand how children surviving cancer experience the oral health complications of cancer and cancer therapy on their life. Each year, approximately 400,000 children are diagnosed with cancer globally. The most common types of childhood cancer are leukemia, brain cancer, lymphoma, and solid tumors such as neuroblastoma and Wilms tumor. Today, more than 80% can be cured with treatments such as radiotherapy, chemotherapy, and surgery. Despite the improvement in mortality rates, cancer treatment can leave harmful impacts on cancer survivors, especially on young people who experience high rates of radiotherapy and chemotherapy-induced complications. Early oral effects include oral mucositis, xerostomia, and oral infections such as candidias and herpes virus infection. Late effects include dental decay and abnormalities in dental and jaw development. Well-being includes the presence of positive emotions and moods, the absence of negative emotions, satisfaction with life, fulfillment, and positive functioning. Specific to childhood cancer, scoping review by Noronha and her supervisor, Professor Macdonald, on the oral effects of cancer treatment demonstrated their effects on the quality of life of children. Beside all information that was gathered in the scoping review, two important limitations emerged. First, the authors note the lack of qualitative research into children's well-being. Second, research into children's oral treatment effect has preliminarily solicited parents and healthcare professionals' views, but children's perspectives are not always consistent with adults. So, the aim of this project is to better understand how oral health effects of cancer treatment impact the well-being of children surviving cancer. This project has two phases. First, a scoping review, and second, a focused ethnography study exploring the oral effects of cancer treatment on children. This study will be underpinned by a theoretical framework developed by my co-supervisor, Professor Carnevale, which recognizes children to be active agents. By active agents, children are seen to have the interest and capacity to participate in decisions and discussions about matters that affect them, and second, have the moral right to engage in such decisions and discussions. To understand how oral effects of cancer treatment are experienced by children, I will use two data generation methods, participant observation and semi-structured interviews. Participant observation will be conducted over 6 months at the Montreal Children's Hospital, where the oral care is provided, and in family homes if permission is granted. During field observation, I will be listening to informal discussions among children, families, friends, and healthcare providers, focusing on information about the child's quality of life and well-being. Field notes will be written during this observation. I will also conduct interviews with 3 groups of stakeholders: children who are undergoing or completed treatments, their family members and social environments such as parents, caregivers, and siblings and friends, and also the healthcare professionals such as the physicians, nurses, and dentists. Interviews will be recorded and transcribed. Children aged 6 to 18 years old will be recruited using purposive sampling to ensure rich accounts of their experiences, and the purposive variables will include age, gender, cancer type, and oral effects. A thematic analysis of the data will be done through a serial of procedures, including coding, assessing micro and mesoterms, generation of narrative synthesis, and cross-participant analysis. Ethics approval will be sought from the Ethics Review Board of the Montreal Children's Hospital. Participants will be informed about the purpose and the procedure of the study, and written informed consent and verbal assent will be gained. Thank you for your attention.